Stop taking video. Oh, okay. Well, here we go, folks. We're doing our anxiety lecture, and this is Mr. Mangino's mini-me. Hello, everybody. Pleased to meet you. So this is anxiety disorders. One class had this lecture already, but I was sick a few weeks ago, so this is to the other class that did not get it. I think it was my Monday class. Let's go to the next slide here. So anxiety is normal and necessary for survival. It warns us of a threatening situation. It's basically the fight or flight response, and the primary neurotransmitter involved here is adrenaline. Also norepinephrine is involved also, and probably some dopamine. It's very important to remember that anxiety and the stressor is always in the eyes of the beholder, so we never tell a patient not to worry about it. We want to get more information as to why they would worry about something. Again, telling somebody not to worry about it is invalidating their experience. Some key terms here: ego defense mechanisms. We'll get to them in a little bit. A compulsion is an action, a behavior to reduce anxiety. An obsession is a thought that you get that creates anxiety. Very typically, it's hand washing. People have a fear of germs, and the compulsion is to wash their hands excessively. A phobia is an exaggerated response, a fear of something that is out of characteristics for the stimulus itself. Somatization means, soma means body, so somatization means taking a psychological symptom and affixing it to something physical. So someone with depression might believe they have cancer, something like that. Dissociation, we've talked about this in previous lectures, is basically your psyche is disintegrating, your ego defense mechanisms used to deal with anxiety are not working, and basically your psyche is falling apart. We as individuals, our psyche is whole. Derealizations, literally things do not seem real to the individual. You seem like you're in a dreamlike state. Depersonalization, again, feeling like you're in a dreamlike state or viewing yourself from outside your body, like you're not part of your body. Epidemiology, statistics here is the most common psych disorder. Probably most people in a lifetime will have it. It says here 50% of the population in a lifetime. I suspect it's higher than that. All of the disorders I speak of are on a continuum from mild to severe. It's all degree and duration. How long do you have the symptoms, and how severe are those symptoms? So all of us are on the anxiety continuum. Many of us, some people are on the bipolar continuum. It's all degree and duration. The anxiety disorders generally begin in early adulthood, as do most of the psychiatric disorders. There are a few exceptions. We'll get to them. It tends to run comorbid with. In other words, when you have anxiety, many times you'll have these other disorders, such as depression, substance abuse, eating disorders, and Tourette's syndrome. Tourette's syndrome is twitches and tics or uttering out curse words. We're doing good, Nance? My assistant?
Keep going.
Okay. Some of the symptoms of anxiety, these are the biological symptoms, autonomic nervous system symptoms. You might remember the autonomic nervous system is fight or flight or rest and digest. Okay. Insomnia, not being able to sleep. Tachypnea, which is rapid breathing, shortness of breath. Tachycardia, rapid pulse. Diaphoresis, sweatiness, dizziness, pins and needles. These are the symptoms you guys probably feel the day you walk into an exam. That you have this shortness of breath, this uneasiness, sweatiness, things like that. And I often recommend that you don't hang around with other students that are anxious the day of the exam. And I also recommend that you cut your caffeine intake in half because you're churning out adrenaline. And if you have too much adrenaline, you won't be able to concentrate. Behavioral, increased motor activity such as pacing, tremors, stuttering, stammering, restlessness. Rituals and compulsions tend to increase. The person gains a sense of control by carrying out these rituals. The person realizes that these rituals or compulsions are silly, but they still must do them. And this is what really separates obsessive compulsive disorder from a psychotic disorder. Someone with a psychotic disorder doesn't realize what they're doing is silly. They believe it. Where someone with OCD has to do it. They realize it doesn't make sense what they're doing, the compulsion, but they're compelled to do it. Also, you'll avoid the situation that produces anxiety. Um, Increased dependence, especially in children. So when children get anxious, they tend to cling to their mother or their caregiver, and they might be crying more. So they manifest their anxiety symptoms in different ways. Psychological symptoms: as a person gets more stressed, their perceptual field gets more narrow. They're unable to focus on a broader array of things, so they become very concentrated on one task. As this anxiety increases, there can be a sense of doom or impending doom, as they say, and a sense of helplessness. As this progresses more, the person can get more confused, unable to focus. Again, obsessions, thoughts, and ruminations continue. A rumination is continuing over and over with the same thought. And if anybody has learned about studied zoology at all, that's what a cow does with what they eat. A cow has like several stomachs, and they upchuck their food to their mouth again from their stomach, and they grind it up again. Okay. Again, psychological symptoms: intense fear, to the point of distortions of reality. At this point, you're so anxious, you're unable to interpret your environment accurately. If it continues, you can dissociate where your psyche is fragmenting. You're not thinking clearly. Let's go to the next slide here. Effects of chronic stress. We now know that chronic stress can have physical implications on the body. There's a direct connection between your body, your mind. So chronic stress, certainly cardiovascular disease, as you're cranking out adrenaline all the time, your heart is working harder than it should. You also have increased cholesterol, hypertension, high blood pressure, again due to increased adrenaline. Over time, your immune system gets lowered. You might even notice in nursing school, you get sick more readily because you're under stress. And when you're under stress, not only do you crank out adrenaline, but you also crank out cortisol. Cortisol is the stress hormone that lowers your immune system. Premature aging, depression, cancer. So again, we now know that chronic stress is detrimental to physical health. Theories of causation, also known as theories of etiology. The biological model, the people who believe in biology, they believe anxiety is genetic. They also say that you may have a lot of adrenaline, possibly dopamine. Remember, these are excitatory neurotransmitters that ramp up your nervous system. Maybe you don't have enough GABA or serotonin. Hey, Nance, can you get me a drink of water?
Certainly, honey. You're getting a little dry.
Okay, yes, I am. Thank you, assistant. My faithful assistant, always here. So maybe people don't have enough GABA or maybe not enough serotonin. We do know that serotonin also can decrease anxiety. How do we know that? We know that when we gave depressed people SSRIs, i.e. Prozac, Zoloft, Paxil, Lexapro, Celexa, that we noticed that their anxiety decreased. Again, we can treat somebody with an anxiety disorder with GABA, but GABAergic drugs are benzos, and the problem with them is they are addictive and you get tolerant to them. Okay. Sorry, I have to sip some water here. The psychodynamic or psychoanalytic model, again, this is Freud. Freud believed that anxiety was due to unresolved internal conflicts, usually stemming from childhood. The ego uses ego defense mechanisms to protect itself against anxiety produced by the superego. So let's go back a little bit with Freud. Freud said you have the id, which is basically the kid. It's I want to have fun now. I don't care about consequences. You have the superego, which is your mother and father saying, do the right thing, be kind to others. And your ego is in the middle trying to modulate both ends of that, the id and the superego. When the superego gets too intense, we use ego defense mechanisms to try to decrease that anxiety. When the ego defense mechanisms don't work anymore, anxiety breaks through. And we'll look at ego defense mechanisms in just a few slides. Okay, well, here they are. Ego defense mechanisms. All people use them. They reduce anxiety and guilt, but rarely solve problems that created the anxiety. For example, You cheat on a test and say to yourself, it's okay, everybody does it. You are using the ego defense mechanism rationalization, trying to get rid of the guilt that you feel about cheating. Now, if you were a sociopath and had no superego, you wouldn't need to justify this because you wouldn't have any emotional anxiety from it. Okay? So ego defense mechanisms don't really solve a problem, but they help us decrease anxiety. Some of these, again, rationalization we just spoken about, making an excuse for why inappropriate behavior is okay. Displacement, discharge of pent-up feelings onto someone who is less threatening. For example, a father yells at his son, he overreacts, he yells at his son, the son can't yell back at his father, so the son, the young boy, goes on the bus and beats up a little kid on the bus. Okay, again, that's displacement. Sadly, I have found that this is what nurses do to each other. We've all heard, some of us have heard the statement, nurses eat their young. In my opinion, what's going on there is you are stressed out at work. You don't go to the boss or administration saying, I cannot handle so many patients, I just can't do it. So you take that anger and displace it on the younger, newer nurses. Sadly, I was a victim of that. Reaction formation, this is acting the opposite of the way one really feels. Example, a latently homosexual male beats up a gay man. He may feel sexually attracted to this man, but he cannot accept it himself, so he acts the opposite and gets aggressive with this other man. Intellectualization, this is the overuse of abstract thinking to minimize painful feelings. For example, a man going through a divorce talks about divorce statistics to avoid the pain inside him. He intellectualizes it. Undoing, trying to undo an inappropriate behavior, usually by being extra nice. Again, the mother maybe scolds the daughter, overreacts, the mother feels guilty about it, and here comes the ice cream man, so the mother buys the daughter an ice cream cone to undo what she did. Compensation, deficiencies in one area are balanced by excelling in another. A student does poorly on a nursing test, but kicks butt. Sorry, I should have had a second T there. I'm not a very good speller. During the basketball tournament. So she's compensating. She feels bad that she did poorly on an exam, but says, I'm a really good basketball player. It gets rid of some anxiety. Sublimation. This is converting a socially unacceptable behavior or drive into an acceptable one. An example of this, an aggressive male with a history of bar fights become a boxer. Well, we can all think of a famous boxer. You guys might be too young to know this person, but there was a famous boxer many years ago, and there probably many athletes might have this. They're aggressive, and they go into sports to discharge that aggression, to sublimate the aggression in an acceptable way. And if you think about this, this really is the basis of all sports. Why would two men get in a ring and pound each other in the head for 12 rounds? Why would 11 men on each team get on a football field and ram each other with helmets and hurt each other? Because men have an aggressive drive that must be sublimated. Okay, so this is the basis of sports. Identification, incorporating the image of another admired person into one's psyche to avoid the anxiety of creating one's own identity. Example here of children mimic their parents. They're trying to develop who they are, who do they identify with, who do they want to become. A teenager dresses like their favorite rock star. When I was young, everybody had hair like Robert Plant. He was the singer for Led Zeppelin. Okay, or Greg Allman from the Allman Brothers. Again, you guys may have your own rock star idols, but they were ours. Regression, regressing to an earlier stage of development when under stress. So when people are under stress, they tend to regress, maybe curl up in a fetal position in bed. Okay? And a little bit of a joke, this is what your boyfriend or husband does when they are sick. When they're not sick, they're all, tough guys. And then they get sick and they curl up in bed and complain and whine like a baby asking for help. And there's my wife making fun of me. Thank you very much. Suppression, the conscious inhibition of an impulse. So you consciously suppress this. For example, you get in a fight with your boyfriend before a test, but you keep it out of your head until after the exam. You're consciously doing this. Resistance, avoiding dealing with an anxiety-provoking situation. This is not uncommon in therapy. A client in therapy changes the subject when the therapist suggests talking about their childhood. So resistance, trying to avoid anxiety, as all the ego defense mechanisms are trying to do. Splitting, what we do is we compartmentalize good and bad. If someone pisses you off, you call them a jerk, and that puts them in the bad category, and your anxiety is done. He's just a jerk. They're just bad. Another ego defense mechanism here is conversion. This is the expression of an emotional conflict through the development of physical symptoms. A classic example here is a man going into battle loses the use of his trigger finger. This man doesn't want to get hurt. His brain is saying, if you go into battle, you might get hurt. So what the body does is makes his trigger finger, which would operate the trigger on the gun, not work. Okay, a conversion reaction. Repression, this is keeping from consciousness unacceptable thoughts and impulses. Very common with victims of severe abuse. They cannot recall the events of the severe abuse. So again, we can see how the mind is trying to protect itself by using ego defense mechanisms. Denial, this is the refusal to accept an unpleasant reality. Classically, this is what's used by people with addiction problems. Early in treatment, they don't think that they don't have a problem. They're in denial about their addiction. In this example here, a person with 5 DWIs denies he or she has a drinking problem, and they might blame the police, saying the police just don't like me, they always pull me over. 1 DWI is a mistake. People learn from that. You don't do it again. When you're doing it again and you don't want to accept the reality, you go into denial mode. Projection, projecting onto others what one feels. A person lies, then claims another person was lying. So they're projecting onto others what they really feel inside, kind of like a camera projecting onto a screen. Well, let's go back to the cognitive model. We've left the Freudian model with ego defense mechanisms. Let's look at the cognitive model. When we think of cognitive, we think of thoughts, cognitions. This would be Beck, Burns, and Ellis. You might remember a book that I brought in early on in the semester called Feeling Good. That was written by Beck and Burns out of the University of Pennsylvania in, I believe, 1978. Okay, they believe anxiety and depression is caused by a misinterpretation of events. They believe these misinterpretations, they call them cognitive distortions. These cognitive distortions don't rise to the level of psychosis, but the people are not perceiving things accurately. And we'll address these more fully in the mood lecture. Actually, we've given the mood lecture already, so you might recall them. The behaviorist, the learning model, which would include Pavlov and Skinner, behaviorists believe anxiety manifestations are due to past behavior to a similar event. For example, you're pushed in a pool as a child, resulting in a fear of water as an adult. Or maybe you're bitten by a dog when you're 8 years old and you have a fear of dogs as you get older. This is all learning, right? The human brain is always learning and taking in data. Well, there's a basic response to stress that we go through. It's called Seeley's General Adaptation Syndrome. There are 3 basic phases. The first phase, the alarm reaction. You have a perceived stress. It causes your hypothalamus to send a message to your pituitary gland. If you remember from anatomy and physiology, the pituitary gland is the major gland of the body. The pituitary gland sends a message to the adrenal gland, which releases adrenaline and cortisol, the pancreas to release insulin, and the liver to release glucose. Again, glucose is the fuel that cells use to react. Okay, so basically you're going into fight or flight at this point. At that same time, there's a resistance phase going on. This is the parasympathetic nervous system slowing down. Again, if you remember, the parasympathetic nervous system is rest and digest. So what happens is the parasympathetic nervous system slows down. It shunts blood to the muscles for fight or flight. And this is why your mother said, do not eat a big meal and go swimming, especially in the ocean. You eat a big meal, you have a big lunch, some ice cream, you're at the beach, and you swim 100 feet out into the ocean, and the blood is now getting shunted to your stomach to digest that food, and you get muscle cramping in your arms and legs, and you could drown. Okay? If the stressor is reduced effectively, either by escape or resolution, the body returns to a resting state of mild anxiety. Maybe relaxation, but most of us sit in mild anxiety during the day. I would consider relaxation as sitting on the couch on a Friday evening watching a funny video. Well, the exhaustion phase, if the stress is not reduced, the body stays in fight or flight mode, but runs out of adrenaline and glucose. The result is a feeling of exhaustion. In fact, athletes call this hitting the wall. Cyclists, runners, they're going in a marathon and they're at the mile 15, and for some reason they just lose all their energy and they stop running and they go home. What probably happened here is they ran out of adrenaline and they ran out of glucose. What athletes do to prevent this is they carb load the night before with pasta and bread and carbohydrates to convert that starch into glycogen to store it in your liver, and it can be released as glucose to keep you going through the race. So endurance athletes tend to carb load the night before a big event. But let's talk about chronically elevated cortisol levels. Studies have indicated that when people have chronically high levels of cortisol, the stress hormone, one of them, it can damage the hippocampus. What does the hippocampus do? The hippocampus helps consolidate memories. So what they've noticed that people with PTSD or chronic stress disorders may very well have poorer memories. The next question is, if we treat that anxiety, will the hippocampus correct itself? And from the research I have done, yes, it does. So now we realize medication does not just get rid of the symptoms of an illness, it can actually help the body heal itself. A little like taking a steroid when you have a very bad cough. It calms the body down. Well, let's talk about the stages of anxiety. Again, as I've said, anxiety is on a continuum, as all of these mental disorders are. The lowest end of this continuum is being relaxed. You're sitting on a Friday evening on the couch, watching a funny movie, your work is done, you're feeling very calm. If you're a little bit revved up or mildly have mild anxiety, the next one is moderate. After that is severe, and the most severe form of anxiety is called panic. We'll talk about these individually in the next few slides. Talking about relaxed, again, no excessive anxiety at home on couch watching TV. Mild, you have mildly elevated vital signs, your perceptual field is increased. This is the best phase of anxiety for learning. You're slightly keyed up. I hope everybody in the room is slightly keyed up so they're paying attention here. As that anxiety increases, you go into the moderate phase. Again, there's no clear demarcations in between each of these. It's a flowing continuum. At this point, with moderate anxiety, you're feeling threatened. Your vital signs are increasing. Your ability to concentrate is decreasing. You're feeling mild shortness of breath, maybe some GI upsets, some twitches, some tremor. This may be where you guys are at during your exams. And that's why you want to cut your coffee intake in half the day of exams. Severe anxiety, excessive adrenergic discharge. You're cranking out adrenaline. You're having palpitations, so your heart's pounding. Dry mouth. Your perceptual field is getting more and more narrow. You're unable to concentrate except on exactly what's in front of you. Decreased concentration and problem-solving ability. So your ability to solve problems is decreasing. The most severe form of anxiety is panic. This is severe shortness of breath, feeling like you're smothering with chest pain or pressure, hot flashes, severe trembling, fear of losing control or dying, which leads to more problems we'll talk about in a few slides. unable to concentrate and problem solve, and again, disorganized thoughts. So panic is the most severe form of anxiety. Let's talk about types of anxiety here. Signal anxiety is the anticipation of perceived danger from past experience that has been repressed. This might be seen in phobias. Again, you were bitten by a dog when you were younger, so now you have a panic attack around dogs. Okay. Trait anxiety, anxiety a person experiences as part of a personality, was thought to be due to many unresolved conflicts that we have been repressed. But probably this is just genetic. Some people are more prone to anxiety than others. And I want to make clear that anxiety is not a bad thing. Anxiety motivates us. Severe anxiety is a problem, but mild anxiety makes us get out of bed because your parents told you, don't be lazy, get up, be productive. So if you stay in bed too long, you get anxious, you get going, you have your cup of coffee, which gives you a little more anxiety, and you're ready for your day. But let's go back. So trait anxiety is part of someone's personality traits. It's probably genetic. State anxiety, anxiety of an uncontrollable situation where fight or flight is impossible. And again, before an exam, you feel butterflies in your stomach, you're sweating a little bit, you're anxious. This is the state of the situation. Free-floating anxiety, anxiety that cannot be connected to any particular event or situation. You just woke up anxious and you'll be fine tomorrow. But I suspect if we laid you on the couch, we would find out what happened on a similar time of the year previously that gives you this anxiety in this particular time of the year. Let's look at the DSM, types of anxiety disorders as per the DSM. Again, we are now at the DSM-5. This is as per the DSM-4. They change it about every 10 years or so. The book gets updated. Nothing has changed in this area, though. GAD stands for Generalized Anxiety Disorder. It's pervasive and excessive worry and other symptoms of anxiety, most of the time for 6 months or more. So we have a time frame. You can be anxious for 1 or 2 days. That doesn't meet the duration to give you a diagnosis of an anxiety disorder in this GAD. Panic disorder, these are sudden feelings of impending doom or death, losing control, or other very severe anxiety symptoms. Fear of a panic attack or losing control in public may cause a person to self-isolate because they're afraid of being publicly humiliated, of having a panic attack in public and collapsing emotionally can scare them so much they may stay home and self-isolate, leading to decreased social supports, loss of friendships, and that can morph into a depression as they stay home and don't have social interactions. As I've said many times, every human, I should say every mentally healthy human, is held up in a fabric of socialization. When people fall out of that fabric of socialization, sometimes it's hard to get back up into that fabric of socialization. Mental disorders do this to people. Depression, anxiety, schizophrenia, bipolar disorder in severe forms, or even physical illnesses prevent you from being around people. We are the most social animals on the face of the earth. How do I know that? We all have a cell phone. As I joke around, if we were cats, we wouldn't have cell phones. But the fact that humans are highly social, we want to be connected to other people. Okay, I'm going to stop this somehow and take a break. Well, it doesn't want to stop, so I'm going to have to plug this thing in until my wife gets back. Hang on. Let's see if I can figure this out.